Hello everyone, this is Jessica Shields, and this is discussion board 2. I want to start by saying how important time is muscle. It's important because when the blood flow is impaired, it triggers an ischemic cascade where the heart cells start dying. When they start dying, they do not grow back, and as a result, the more cells that die, the increase the amount of heart damage that occurs. And if the occlusion persists greater than 20 minutes, irreversible myocardial cell damage and cell death will occur. So I want to start by saying some of the patho of a STEMI. The severity of an MI depends on usually 3 factors: the level of the occlusion in the coronary artery, the length of time of the occlusion, meaning time of muscle, and the presence or absence of collateral circulation. A STEMI is usually the result of complete coronary occlusion after plaque rupture. Most STEMIs are caused by a disruption in the vascular endothelium associated with an unstable atherosclerotic plaque that stimulates the formation of an intracoronary thrombus. So when cholesterol deposition within the wall of the artery, the deposited cholesterol forms a plaque wall. The plaque can trigger platelet aggregation, which leads to the occlusive thrombus. The occlusive thrombus then blocks the artery and interrupts blood supply to the heart muscle, which will lead to the symptoms that most patients present. So for example, we had a patient come in and they had chest pain, dyspnea, heartburn, and tachycardia. So first, the doctors ordered an ECG and blood work to check the cardiac enzymes. After the results came back, it showed the patient had elevated troponins. The EKG showed ST elevation, and they also had elevated CK-MB, which is the cardiac enzymes, as well as the troponins. So first we started the patient on oxygen, nasal cannula, and because the patient O2 sats was 85%, and they were definitely having some difficulty breathing. So then we gave nitro sublingual times 3. We waited a few minutes in between. That did not relieve any of the symptoms, so we started the patient on a nitro drip. Then and the nitroglycerin is used to relax the vascular smooth muscle. So we started, and in addition to the nitro, we gave aspirin, and the aspirin is used to decrease the platelet aggregation that I talked about earlier, that the plaque triggers. We also gave the patient morphine, and that helps with pain as well as the difficulty breathing. In addition, we gave the patient a beta blocker, and the beta blocker is used to decrease the myocardial oxygen demand, and that does that by decreasing the heart rate. And so that did relieve the tachycardic. So then we gave the patient a thrombolytic therapy. We gave him Retaplace, and that was to try and relieve the occlusion, to break it up, the thrombolytic. They say that the PCI should be completed within an hour if the thrombolytic therapy is not successful. So the cath lab was called and prepared, and within about 45 minutes, the labs were still the same. The patient was still having pain, so we took him to the cath lab for a PCI. They ended up realizing that he did have a few of his coronary arteries blocked, and he did not have adequate collateral circulation, and so that made the severity of the STEMI even worse, because usually whenever a patient has collateral circulation, they're still getting some blood flow to the heart by those extra arteries that are supplying the heart. As a patient ages, usually the collateral circulation decreases. So a stent was placed, and we monitored the patient after that, and the patient ended up doing well, and he was discharged a few days after. So to sum it up, time is muscle, and that is a very important factor that we strictly go by. We have guidelines that make sure we give the oxygen and the nitro and the aspirin within a few minutes of them being admitted, and then thrombolytic therapy is usually within 30 minutes, and then PCI within an hour to 90 minutes is usually where our guidelines say. And that sums it up. We did find out that the patient had a transmural MI, and that means the damage extended through the whole thickness of the heart. So all three layers were damaged. But the stent placement will help with his further or future complications. And that's it. Thank you.